skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon. And today I'm going to be talking about Botox. In this video, I'm going to be going over when you might want to start using Botox, and if you do decide to use Botox, what you can expect when you go into the office to get that Botox, and what some of the considerations are and expectations for after getting Botox and getting your results. When should you start using these neuromodulators? And well, the first thing is you have to be at least 18 in the US to use any of these products. So that's your starting point. And in general, I'd say people are coming in anywhere from their 20s and 30s, and I'll see them coming into their 60s and 70s asking me about neuromodulators. The perfect time to do it is before you're getting the static etched in wrinkles. A lot of patients come to me when it's already too late, and once those wrinkles are etched in, you're looking at different treatments. So that's why we'll say that if you come when you're younger, your 30s is a great time, maybe your 20s, depending on your own anatomy and your own goals. You want to come kind of in that range, because that's when the lines are starting to form, and by doing it repetitively over years, you actually can get such a softening of the muscles that you're kind of reversing the clock, right? I always think of it, if you started Botox when you're 30, then when you're 40, you've had 10 less years of those muscle actions to be etching in any lines. So it's like almost like being 10 years younger in terms of specifically the movements of the muscles. So that's when I tell people to start thinking about it, maybe mid 20s into your 30s and beyond. Once you're getting into your late 40s, 50s, and beyond, where you're getting those etched in lines, you're really looking at laser resurfacing, deep peels, and fillers is what you're getting into. But everyone's different, so make sure that you have a consultation with someone who knows what they're doing, a board-certified dermatologist, plastic surgeon, and they can direct you into the right direction of what you should do. Did any of this surprise you? So let me know. Drop it in the comments. Another technique you might have heard about is baby Botox, and that's a little bit different than when we do normal cosmetic Botox injections, and it might be for younger patients who are really trying to get a jump on the ball, or to people who are newer to Botox and they just want to get their feet wet and kind of see what it's like. And we use lower doses of the Botox than our standard dosing, and that's just to help soften the muscles a little bit and give a little bit more preventative treatment than actually treating strong muscles and lines that are forming dynamically already. And when we do the baby Botox, we still get some preservation of the muscle movement, so there still might be some movement, but we're just weakening the muscles to help delay it. And that's commonly used in areas like the glabellar complex, where you frown, the forehead, or the crow's feet, or the lines around the eyes. On that note, who should not get Botox? And that is anyone who is pregnant, breastfeeding, or has a condition called myasthenia gravis, which you would know if you had it. It's a condition that affects the neuromuscular junction. And if you don't have any of those conditions, you should be good, but I would definitely consult with your physician and let them know any of your medical problems that you might have before starting any procedure, really. So now you're ready to do Botox, you come to your visit, what happens? So what you can expect is that the provider will come in. They often will mark you with a cosmetic marking pen. They'll study your wrinkles and your movements and decide where they want to best place the neuromodulator toxin. They'll probably take before photos so that they can also get after photos. In general, it's very quick to do neuromodulators. Sometimes it takes a little time to get it prepared. You have to reconstitute the Botox, draw it up into syringes, and then come back in. But in general, the procedure doesn't take very long in the office. So after the provider has marked out where they want to put the injections, then they will hopefully go over how many units they want to use, give you a price, and then using an alcohol wipe prior to each injection, they'll do little tiny injections into all the points. And it really, I personally don't think that it hurts very bad. Everyone's pain tolerance is a little different. It's just a little prick, and then you'll have what might look like a little bee sting, a little redness or swollen area. That usually goes down within 30 minutes to an hour. And some places use cold packs prior to doing the injections to help numb the area a little bit. Some people use vibrating devices to kind of trick the nerves, but a lot of people don't use anything and just do the injections because they're really not that painful in the spectrum of things. What I generally tell my patients is to arrive with a clean face, don't wear makeup, it just makes everything a lot easier. And I let them know that after the procedure, they shouldn't do any vigorous exercise for the rest of the day. They shouldn't do any facial massage because you don't want the product to move into places that we didn't want it put in. And that's about it. You can go back to work afterward. You might have like a few splotchiness areas on your face, and you could potentially have little bruises in certain areas where sometimes the little blood vessels get hit. After the procedure is done, you might start noticing the effects kick in over the next 2 to 3 days, and full paralysis of all the muscles occurs by 2 weeks. So usually I have my patients come back at that time so I can take a look, see if we want to add any more, and but generally the results will start around 2 to 3 days and full effects will take place by 2 weeks. Sometimes people can get headaches after Botox injections, especially new Botox users, so don't be alarmed if that's something that happens. You can get headaches, and that's something that would not be unexpected. The next thing you might be wondering is, how long does Botox last? And the answer is generally it lasts anywhere from 3 to 4 months. For all of the different neuromodulators that I talked about earlier, you're going to get a quote of around 3 to 6 months depending on what product it is. Neuromodulators like Daxxify or Jeuveau might last a little bit longer, towards the 6-month spectrum, but all of it depends on the person. Some people break it down more easily than others. Some people have stronger muscles, or they make the action more repetitively, so that causes it to wear down more quickly. At this point in the video, you have a pretty good understanding about Botox and other neuromodulators. That's all for this video. Hope you found it useful. If you liked this video, make sure to hit the like button, share it with your friends, subscribe to my YouTube community, and make sure to hit the little bell icon so you can get notifications anytime I post a new video. If you have more questions about Botox, make sure to check out my other videos. I have one that discusses what Botox is, what the uses are for Botox, and I have another video that talks about what you can expect if the Botox goes wrong and what the potential side effects are from that. And if you have any other questions, feel free to drop a question in the comments below. Thanks so much. Hope this information was helpful to you.